So you're getting eyelid surgery. Congrats. Now let's make sure you show up prepared and things go smooth. 2 weeks before surgery, stop taking anything that can make you bleed excessively. That means aspirin, ibuprofen, Aleve, fish oil, vitamin E, and lots of other medications. We gave you a list when you scheduled. Be sure you read it well in advance. The day of surgery, let's keep it simple. No makeup unless you want me to spend the first 5 minutes of surgery wiping that off your face. Wear comfy clothes. This isn't a fashion show, it's eyelid surgery. Bring someone to drive you home. An Uber driver does not count unless they're also willing to move in with you for 24 hours. Now let's talk about food, because I know you care. Are you getting only local anesthesia in the office? You can eat beforehand. Don't show up starving and cranky. Getting deeper sedation or general anesthesia? Do not eat. Not even just a little snack. Nothing after midnight. Forgetting this can get your surgery canceled. If you aren't sure, give us a call. And most importantly, show up on time. We need time to get you prepared for your surgery, and we'll take it from there. You'll be all set for a successful surgery, and you will do great. We'll be here to support you all the way along.